Hey, so we wanted to talk today about the first 5 minutes of a medical emergency. The first 5 minutes are critical. Arguably, the first 30 seconds are critical, but that first 5 minutes is where we can really make or break the situation, where we can really help people or just be kind of ineffective in going through the motions. So we wanted to talk a little bit about some of the things that we can do in that first 5 minutes to really be the most effective that we can be in aiding people in a medical emergency in the church.
Yeah, so first thing you need to do is assess the situation, right? You need to know what's going on. And one of your favorite quotes is, calm is contagious. I've stolen that, and when I train my safety team, they've probably heard that from me more than anything else at this point as well. But being that calming presence is key when you're dealing with a medical emergency. Also, you want to make sure you don't become a victim. So you need to scan for hazards. You know, if someone's laying in a pool of water, maybe they were electrocuted. Probably should, before you dive in, literally, maybe check it out. And then, of course, you want to check if the person's conscious and go through your ABCs, airway, breathing, and circulation.
Yeah, I always, one of the examples I always use in first aid training is, if you walk in and there's like 5 people passed out on the floor, the odds that 5 people had a heart attack at the same time are pretty low. Gas leak, much higher possibility, but yeah, don't be a victim. That's awesome. So the second thing is you got to call for help. You've got to get 911 on the way. We always talk about, 911 response, it's 7 minutes or whatever. It's 7 minutes from when you let them know. So if you waste 3, 4, 5 minutes until you let them know, all of a sudden you're now talking 10 or 12 minutes versus the 7 minutes. So if you're not capable of calling 911 right away, designate somebody. Don't suggest it. Tell them you call 911. Tell them what we need, and get the cavalry on the way.
Absolutely.
Because once you start doing CPR, they can't get there fast enough.
Yes. Yeah. So after you've assessed the situation, you get help on the way. We always suggest you follow the March protocol. So you're going to start looking for your massive hemorrhaging and treat that first because your body needs the blood to stay inside. And then you move through airway and then respirations, circulation, and then hypothermia and head injuries. And you go in that order because that's the priority that increases their likeliness of survival.
Yeah, I know that's a change from like years ago when I started taking CPR and stuff. It was always just airway, breathing, circulation. They got to be getting air. And, people jump in there and they start doing CPR and it's like, okay, but if they've got a serious life-threatening bleed, all you're doing is helping them die quicker because you're helping pump the blood out of them. So, we've got to plug that first. This is a hydraulic system. The fluid's got to stay inside to keep working. That kind of leads us into the next one, severe bleeding. That is your first priority. You've got to control that bleeding. It doesn't matter if we can get that heartbeat going or trying to circulate the blood if it's spurting out somewhere else. So we've got to deal with that, whether it is by applying a tourniquet, whether it is by wound packing or pressure dressing, whatever that is, we're going to need to take care of that severe bleeding first before we apply anything else. One of the things I say in training a lot is, you can survive 7, 8, 10 minutes without oxygen to the brain. If you bleed out 90 seconds, it's kind of pointless. Yeah. So we got to take care of that first.
Yeah. So speaking of surviving without oxygen, unconscious and not breathing patients or victims, obviously you're gonna check, make sure they're not just taking a nap in the middle of the floor. Try to wake them up. If they're not breathing and not responding, you need to initiate CPR. And obviously you're going to do that with good chest compressions. And if you don't know CPR at all, you can just start with chest compressions until someone who knows how to do CPR gets there. And then also you're going to want to get someone to get an AED. That's always part of your CPR training is, hey, you call 911, you get the AED, and then you start chest compressions.
And we've kind of learned through experience, and experience is a great teacher. Bring the AED no matter what, because you just never know where that situation is going to go. That kind of leads us into the next one, which is choking. People that are choking, they have an obstructed airway. They're not getting air in anymore. That's life-threatening. If that goes on long enough, we may need that AED. What started out as simply, okay, well, they're choking, and we're going to do abdominal thrust, we're going to do back blows, that sort of thing. If it goes on, it becomes a breathing emergency. They stop breathing, then their heart stops going, and that AED is going to be helpful. So always bring that AED to the scene. And what I've learned the hard way is don't put it away until it's done. We had a situation at a church that we were serving at. The guy had seizures, and it was well known. He had a history of it. So he started having a seizure, and it was kind of like, okay, he's having a seizure. We'll deal with that. Actually put the AED away, and as the seizure went on, his heart gave out, and all of a sudden we needed the AED again. And we used it a lot. We shocked him 7 times. EMS shocked him another 3, I think, in the 1.5 miles from our church to the hospital. So yeah, he's alive today and has his own AED implanted in there.
Yeah, that helps out. So speaking of cardiac events, you want to know the symptoms of heart attacks and other cardiac issues. Actually, that same church, we had a team member. His heart rate was skyrocketing. I checked his blood pressure. I'm a medical professional, so I do a little bit more diagnostics if I have time. And his blood pressure was stable. I mean, he was revving up to like 210. Heart rate came down finally. It shot back up, sent him to the hospital where he had to get cardioverted. So had we not noticed those symptoms and been able to, kind of mini diagnose his tachycardia, we might have been using the AED again. So I always recommend if it's chest pain, especially in the middle of the chest, and it's either crushing or stabbing, from front to back, you may as well just get EMS there. They have the tools to really kind of find out what's going on, because you don't want to play with a heart attack.
Yeah, and one thing that kind of gets overlooked in a lot of this is aspirin. If they are conscious and you ask them if they have an allergy to aspirin or a bleeding ulcer, if the answer is no to both of those, give them the aspirin. Have them chew it. Don't just swallow it, chew it up so that it absorbs more quickly. Just regular, chalky, old, plain aspirin, not Advil or Tylenol or anything like that. It makes a huge difference in survivability. Of course, and again, only if they're conscious. We never give anybody that's unconscious anything by mouth, whether it's water or aspirin, anything like that.
Absolutely.
And then the other thing is just stay with them. Stay with them because you want to be able to monitor if there are any changes in their responses, any changes in their breathing, in their speech, anything like that. But staying with them, keeping them calm, just keeping them talking while you're waiting for EMS to get there.
Yeah, and that's important too, because I know working EMS, one of the 3 things we typically will ask is what's their baseline? Are they like this normally? How were they when you found them? And then, what's their condition now? And that kind of tells us, what trajectory they're on as far as, what could be going on. So knowing those 3 things, like, if someone has a speech impediment, we don't know that. Now we're thinking, oh, this person might be having a stroke. Right. Knowing like, oh no, that's how he normally talks is pretty important. So speaking of which, when EMS arrives, so you're gonna hand them off to the professionals. You don't have to give some super elaborate report. Don't think about Grey's Anatomy or ER or anything like that. Just tell them how they were when you found them, what you did to keep them alive up until this point, and send them on their way.
Yeah. There's 2 times that time is really a big factor. One, if we suspect there's a stroke, time really matters on that. What is the first time that we started seeing those symptoms? And then the second thing is if we applied a tourniquet.
Yes.
Of course, most of the tourniquets, a lot of the tourniquets have the space on there where you can write the time. But if you can't write it on there, just make a note of it so that they know.
And then also, if you did start CPR, how long you've been doing CPR as well.
Yeah. So there you go. Those are some things in the first 5 minutes at a medical emergency that could happen at your church this weekend. We like to talk about all the sexy topics, with active shooter and whatever, but there's a really good chance you're going to need this a lot more often than you're going to need the shooting stuff and all the tactical equipment.
Yep.
So, all right. So that's kind of where we're at. If you got any value out of this, like, share, subscribe, do all the things. There's some links down in the notes down below that can help you get some resources, and subscribe, and we'll have more videos coming your way. So
stay safe.